Today we're talking with Dr. Virginia Lee from Capital Oral and Facial Surgery Center about all the new happenings at their office. Good morning and welcome back.
Why, thank you very much, Angela.
You know, I'm always happy to talk to you, and now you're promoting your cosmetic enhancement program.
Yes.
And I understand you've got a new member.
I sure do.
Christine Perneris?
Yes, Christine is a great add to our program, and in my opinion, we've always been a little bit shy as far as getting the word out as far as what you can do to make yourself look great.
Okay.
So Christine is really, her focus is really making you look as good as you can ever look.
So she has to be special for you to include her in your team. What was it about her that made you say, okay, she might be the one for us?
You know, she, first of all, has a great way of talking to you and finding out what you really, really want or need. Because, in our industry right now, the major thing is first appearances. And you want to look young. Nobody wants to look their age. And of course, we're always fighting it as much as possible.
This is true. And Christine is an aesthetic nurse.
That's right.
So what is that exactly?
She actually specializes, and she has extensive training in doing all of the injectables. And that means all of the things that make you look better. And that may include Botox, Dysport, Restylane, Juvederm, all of these other different injectables that actually enhance your appearance. And that's really her specialty.
That's really good, because so many people think, all right, if my face starts dropping or if I start getting all these issues, I have to go under the knife. You're basically saying, maybe not.
You can hold off the knife for a while. And honestly, with good care, and that means eating properly, drinking plenty of water, and then you can enhance it to your appearance just a little bit more by just a few little injectables. Believe it or not, can make a world of a difference for how you feel and your confidence level.
I've never tried it, although I think when things start happening, I'm definitely going to do something. This might be the way to go.
Sometimes it's so subtle that people just look at you and say, like, hey, you look like a little bit more refreshed. Have you been sleeping better? And you're deep down, you're saying, well, actually, I've had a little bit of help there.
But to yourself, you don't.
That's right. You don't have to tell everyone about that.
So your cosmetic enhancement program, I know you teeth, skin, everything. It's all about just making people look better. You're going to have a big reception coming up, and I guess you're going to introduce your new aesthetic nurse. Tell me what's going to happen. Tell me about your program.
So this is really more or less like an advanced Botox party. We are having a big open house, and we're introducing Christine to the public. It is open to the public, and we are actually offering 15% off of any of these injectables, and which is tremendous for anyone who has had it done before, the veterans who are like Botox users and things like that, or the new person who has never had it done and just wants to try it out. So it's a nice way to try it out.
Okay, now you said 15, 1-5, not 50.
That's right, 15%.
Okay, for somebody like me who's a little bit skittish, I've never had anything, but again, I'm open. If I were to go and get Botox, could you just kind of walk me through what happens?
Sure.
You see these people, or the perception is that your face is just going to be frozen. Probably not the case.
Not always. Now, it depends on what the person really, really wants. And obviously, we ask you what you really, really want. Do you want to have a nice, smooth complexion, especially in between your brow? Or do you want to have that mask appearance? Some people actually do want that. They want to be completely expressionless, or they want to have a really nice, smooth appearance on their forehead.
Really?
So Botox, believe it or not, to do that, it's so simple. Either we use ice to freeze the area a little bit so you don't feel the little injections, or we can use a little topical anesthetic, and that numbs the skin very nicely so you don't feel anything.
And then how long does something like that last?
It lasts about 3 to 4 months.
Months?
Yep. And then eventually your body will break it down, but then you come back and we just re-inject a little bit more.
See, the good thing about that is if you have surgery, you're kind of stuck with it.
That's right.
If it's this, you deal with it for a couple of months, and if you don't like it, you don't get it again. If you like it, which chances are you will.
Most people do.
You'll come back. Now, before we let you go, tell us where the reception is going to be, where your Botox party.
Yes. Our party's going to be here at my office, and it's located about 5 minutes from here. And it's at 1145 19th Street, Northwest, Suite 777, and that's in downtown DC, Northwest. And of course, it's actually on Wednesday, August 8th, from 5:30 to 8 o'clock.
Any charge to get in?
No charge to get in.
Awesome. Well, you just might see me at your Botox party.
I hope so.
Thank you so much, Dr. Lee.
Thank you.
And we'll have more Let's Talk Live coming up right after this.